hold on to your seat because I'm about to unveil a truth that might genuinely shock you. Imagine something you rely on daily, perhaps tucked away in your bathroom cabinet, could be quietly, insidiously eroding the very foundation of your health, your heart. I'm Dr. Mandell, and after 2 decades immersed in the complexities of cardiac surgery, I've witnessed countless heartbreaking scenarios. I've seen vibrant, seemingly healthy individuals arrive at my operating table, not due to sudden illness, but because of damage inflicted by medications they had trusted completely for years. We're not talking about obscure experimental compounds here. I'm referring to that common pain reliever you reached for this morning, the stomach discomfort pill you swallowed with breakfast, or even the familiar cold medicine you grabbed without a second thought just last week. What I'm about to reveal flies in the face of nearly everything you've been led to believe about the so-called safety of these everyday medications. The vast pharmaceutical empires certainly don't want this information widely known, and regrettably, many doctors simply haven't connected these devastating dots in the same way I have. But I've seen the pattern repeat itself, patient after patient, heart after heart, and I refuse to stand idly by any longer. By the time you finish watching this, you will possess the critical knowledge to identify 5 specific types of medications secretly undermining your heart's strength. Understand why they pose such a pronounced danger, especially once you're over the age of 60, and most importantly, discover practical, immediate steps you can take today to safeguard your most vital organ. This isn't about sensationalism, it's about life-saving clarity. Please stay with me, because absorbing this information could quite literally add precious years to your well-lived life. Let's begin with medications that are practically staples in every American home. The non-steroidal anti-inflammatory drugs, more commonly known as NSAIDs. You're familiar with them under names like ibuprofen, naproxen, and diclofenac. These are often your first line of defense against nagging headaches, persistent back pain, or the daily discomfort of arthritis. There's no denying their effectiveness. They can provide brilliant relief. However, there's a crucial detail that often goes unspoken. Regularly taking these pills once you've crossed the age of 60, especially if you have even minor underlying heart concerns, can be akin to playing a perilous game of Russian roulette with your cardiovascular system. The medical establishment has quietly harbored this dark secret for decades. Back in 2005, the FDA recognized the gravity of the situation and demanded explicit warnings about increased risks of heart attack and stroke on these very medications. Yet despite this, millions continue to pop them daily, completely unaware of the lurking danger encapsulated within each unassuming tablet. Consider the poignant case of Michael, a vibrant 72-year-old who cherished his garden. He suffered from knee arthritis and relied on his daily NSAID dose to keep the pain at bay so he could enjoy his passion. One afternoon, while meticulously tending to his prized rose bushes, an unfamiliar wave of exhaustion washed over him. He found himself desperately gasping for air, and he noticed his ankles had swollen to an alarming size. When rushed to the emergency room, we found him in the throes of acute heart failure. His heart, already working diligently due to his age and mild hypertension, simply couldn't keep pace with the demand. The insidious trigger wasn't a sudden new cardiac condition. It was the continuous long-term use of that seemingly harmless anti-inflammatory pill. So how can something so commonplace prove to be so profoundly detrimental? The mechanism is surprisingly subtle but devastating. NSAIDs work by blocking certain enzymes to quell inflammation, but in doing so, they also inadvertently disrupt other substances essential for protecting your kidneys and blood vessels. This cascade effect leads to 2 critical, catastrophic outcomes. First, they force your body to retain extra salt and water. Imagine your heart as a powerful pump. If suddenly there's a significantly larger volume of fluid surging through your body's pipes, that pump must operate at its absolute maximum capacity just to keep up. A young, healthy heart might weather this increase increased stress, but a heart already contending with age-related stiffness or fighting against high blood pressure can simply fail, much like Michael's did. Second, NSAIDs can constrict your blood vessels, leading to an unwelcome rise in blood pressure. Even if you've never had hypertension, regular use can significantly elevate it. And if you're already taking medication to manage your blood pressure, NSAIDs can shockingly counteract their beneficial effects, causing your pressure to dangerously spike without you ever realizing the silent battle your body is fighting. It's absolutely critical to understand that the level of risk scales with both the dosage and the duration of use. Drugs like diclofenac and high daily doses of ibuprofen, around 2,400 milligrams, are the most strongly linked to serious cardiac problems. While low-dose naproxen might seem marginally safer, the inherent risk is never entirely eliminated. And here's another astonishing fact. If you're diligently taking low-dose aspirin to protect your heart, certain NSAIDs, such as ibuprofen, can actually negate that crucial protective effect entirely, leaving you vulnerable. So what course of action should you take? The answer isn't to simply endure debilitating pain. It's to initiate an open, honest, and direct conversation with your trusted physician. Ask them plainly, "Doctor, given my personal medical history and age, what truly is the safest and most effective pain relief option for me?" There are indeed viable alternatives. Sometimes acetaminophen can provide sufficient relief. In other cases, topical anti-inflammatory creams or gels, which work precisely where they're applied with minimal systemic absorption, prove to be excellent choices. And if an NSAID is deemed absolutely essential, the golden rule prevails. Use the lowest effective dose for the shortest duration possible. Now, we turn our attention to the fourth type of medication on our list, and this one might truly astonish you because it's frequently promoted as a stomach protector. I'm referring to proton pump inhibitors, or PPIs, which include familiar names like omeprazole, pantoprazole, and lansoprazole. These are, without exaggeration, among the most widely prescribed medications across the globe. Millions of people routinely take them every morning, almost like a ritual, to combat persistent reflux or to shield their stomachs from the harsh effects of other medications, such as the NSAIDs we just discussed. And here lies the profound irony. The very medication prescribed to protect you from one risk might, in fact, be quietly introducing another danger through the back door. Let me share Helen's story. At 68 years old, she was prescribed omeprazole for her chronic reflux and was instructed to take it for life. Her acid reflux thankfully disappeared, and she never once questioned its long-term necessity. Years later, during a routine annual checkup, her electrocardiogram showed some unusual irregularities. Further blood tests revealed the underlying cause. Her magnesium levels had dangerously plummeted. Magnesium is the silent guardian of your heart's delicate rhythm. When its levels are depleted, your heart can become electrically unstable, much like an orchestra suddenly deprived of its conductor, leading to the potential emergence of dangerous and irregular heart rhythms. The root cause of Helen's severe magnesium deficiency was traced back to her chronic omeprazole use. PPIs are incredibly effective at reducing stomach acid, but that natural stomach acidity is absolutely vital for the proper absorption of many essential nutrients. When you suppress it long-term, magnesium absorption can drastically collapse. But the concerns don't end there. Something even more deeply worrying has come to our attention. Multiple reputable observational studies have uncovered a troubling association between the long-term use of PPIs and an increased risk of heart attack. One prevailing theory suggests these drugs might diminish nitric oxide levels, a crucial molecule that ensures your blood vessels remain flexible and pliable. When nitric oxide is depleted, your vessels can stiffen, effectively setting the stage for a potential heart attack. While the direct causal relationship is still a subject of ongoing scientific debate, the consistent association is profoundly concerning. Furthermore, omeprazole specifically can interfere with the effectiveness of other vital medications, such as clopidogrel, an antiplatelet drug frequently prescribed after heart attacks to prevent further clots. This interference can render this life-saving medication less effective, leaving patients critically vulnerable. The fundamental problem is that these powerful drugs have, unfortunately, been trivialized. They were originally developed and intended for short-term treatments, typically lasting only 4 to 8 weeks, but they have morphed into a permanent, often unquestioned solution for problems that could frequently be managed just as effectively, if not more so, with targeted lifestyle modifications. If you've been taking a PPI for many months or even years, please do not stop abruptly on your own. Doing so can cause severe acid rebound. Instead, engage your doctor in a candid conversation. Ask directly, do I truly require this medication long-term? Is it possible to safely reduce the dose? Are there alternative strategies or lifestyle changes we could explore? And if chronic use is indeed medically necessary, it's absolutely essential that your physician monitors your magnesium levels periodically to prevent potentially dangerous deficiencies. Before we delve into the next crucial medications, including some incredibly common ones you might reach for during a simple cold, I have a quick yet heartfelt request. If the insights you've gained so far resonate as truly valuable, I humbly ask for 2 straightforward actions. First, please consider subscribing to this channel. My driving mission is to deliver clear, unbiased, and straightforward health information, empowering you to make the most informed decisions about your well-being. Second, and perhaps even more profoundly important, share this video widely. Think about your beloved parents, your cherished grandparents, your closest friends. A single click sharing this critical knowledge has the potential to spark a conversation that could, quite genuinely, save a life. Thank you sincerely for your support and for being a part of this vital health community. Let's now continue with our third revelation, a medication almost everyone keeps in their home. We now turn our attention to our third category of concern, oral decongestants for colds and flu, particularly those containing ingredients like pseudoephedrine or phenylephrine. These are often seen as the magical solution for that persistently stuffy nose that just won't clear. However, that seemingly simple magic solution can come at an extraordinarily high cost for your heart, especially if you already live with high blood pressure or have any existing cardiovascular disease. Let's consider Margaret, a lively 75-year-old retired teacher who caught a particularly nasty cold. To find relief and breathe easier, she purchased a popular over-the-counter cold remedy containing pseudoephedrine from her local pharmacy. By the second day of use, she described a terrifying sensation as if her heart was pounding uncontrollably, threatening to burst from her chest. This was accompanied by debilitating dizziness and a splitting headache. Her worried son rushed her to the hospital. Upon arrival, her blood pressure was dangerously elevated, and she had developed an alarming arrhythmia. It was unequivocally clear that the decongestant she had taken had pushed her delicate system to the very brink. Why does this alarming reaction occur? Pseudoephedrine and phenylephrine are powerful vasoconstrictors. Their primary job is to narrow blood vessels. In your nasal passages, this effect is certainly desirable as it reduces swelling and allows you to breathe freely. However, the drug doesn't exclusively act in your nose. It circulates throughout your entire body, constricting blood vessels everywhere. This widespread action generates 2 major dangerous consequences. First, by significantly narrowing your arteries, your heart is forced to pump against much greater resistance. It's much like trying to push water through a hose that's been severely squeezed. The internal pressure skyrockets. This can trigger a sudden, dangerously high blood pressure spike. Second, these decongestants are also potent stimulants. They cause your heartbeat to quicken and potentially to become irregular. If your heart is already sensitive or compromised, this additional stimulation can destabilize it completely, leading to serious cardiac events. It's worth noting that European agencies have recently reignited focused attention on pseudoephedrine due to its concerning link with rare but very serious syndromes involving the constriction of blood vessels in the brain. This serves as a stark reminder of just how powerful and pervasive its effects are throughout the entire body. The gravest danger associated with these widely available drugs is their over-the-counter status. People purchase them casually without carefully reading the crucial fine print and without fully considering the inherent risks. If you are over 60, and particularly if you suffer from hypertension or any heart condition, it is strongly advisable to avoid them completely. Fortunately, much safer alternatives exist. Simple saline nasal sprays, humidifiers, or targeted nasal sprays containing corticosteroids that act only locally directly in the nasal passages are far safer options. Please do not allow temporary relief for your nose to unwittingly transform into a life-threatening emergency for your precious heart. Now we move to the second medication on our list, addressing a delicate yet vitally important aspect of health: mental well-being. I'm referring to an older class of antidepressants, known as tricyclic antidepressants, with names like amitriptyline or imipramine, which are still occasionally prescribed. These drugs are sometimes used for depression itself and other times to manage chronic pain conditions. It's crucial to understand that depression by itself is a recognized risk factor for heart disease, which is precisely why treating it effectively is paramount. However, how we choose to treat it matters enormously, and these specific drugs can indeed pose significant dangers for an older person's heart. Take, for instance, Frank, a 78-year-old gentleman who endured terrible neuropathic pain in his feet due to diabetes. His doctor prescribed a low dose of amitriptyline, which did provide much-needed pain relief. However, Frank soon began experiencing debilitating dizziness every time he stood up quickly. One unfortunate day, he fainted, leading to a severe hip fracture. The root cause was identified as the amitriptyline, which had triggered a sudden dramatic drop in his blood pressure upon standing, a condition known as orthostatic hypotension. But this isn't the only risk these medications carry. Tricyclics can also accelerate your resting heart rate, placing a constant, unwelcome stress on an already aging heart. And perhaps most concerning, they have the ability to interfere directly with the heart's intricate electrical system, slowing down its crucial electrical impulses. This can be clearly observed on electrocardiograms and significantly elevates the risk of very dangerous ventricular arrhythmias, which have the potential to cause sudden cardiac death. For all these serious reasons, tricyclic antidepressants are no longer considered the first choice treatment for depression in older adults. Today, we have the benefit of newer antidepressant medications that generally boast a much safer profile for the heart. Nevertheless, these older tricyclics are still prescribed, particularly for neuropathic pain. If you or a cherished loved one are currently taking one of these medications, it is absolutely fundamental to have a candid discussion with your doctor. Inquire directly. Have safer alternatives been thoroughly explored and tried? Is your blood pressure and heart rhythm being carefully and regularly monitored? Remember, mental health and physical health are inextricably linked. You must ensure that treatment for one isn't inadvertently damaging the other. Finally, we arrive at number one. This is arguably the most controversial and widely debated topic on our list, yet it is my solemn duty to bring to your attention the growing concern that exists within the scientific and medical communities. I'm speaking surprisingly about calcium supplements. Yes, you heard me correctly. Those pills that millions of people diligently take every single day, believing they are actively protecting their bones from the ravages of osteoporosis. For many decades, the message was universally crystal clear: consume calcium for robust, strong bones. However, in recent years, an increasing number of rigorous studies have begun to critically question the long-term safety of these particular supplements, specifically for the heart. Let me share the experience of Linda, a 70-year-old woman. Deeply worried about developing osteoporosis, she independently started taking a high-dose calcium supplement. Years later, she suffered a heart attack. What made her case particularly perplexing was the absence of the classic heart attack risk factors. factors. She didn't smoke, and her cholesterol and blood pressure levels were consistently healthy. As her medical team meticulously investigated possible causes, their attention increasingly focused on that daily calcium supplement. The controversy surrounding this is real, and the scientific evidence, I must admit, is not yet definitive. However, the hypothesis that deeply concerns us goes like this. Calcium obtained naturally from food sources, such as dairy products or leafy green vegetables, doesn't appear to pose a problem. It's absorbed slowly and judiciously by the body, which then utilizes it efficiently where it's needed. The potential problem, however, seems to emerge with the high, concentrated doses delivered by supplements. When you take a pill, it creates an unnatural, rapid spike of calcium in your bloodstream. Your body often struggles to direct all that excess calcium efficiently to your bones, and that surplus has to find somewhere else to go. The primary concern is that this excess calcium may begin to deposit within the walls of your arteries. This process, known as arterial calcification, gradually makes your arteries rigid and contributes significantly to the formation of the dangerous plaques that ultimately lead to heart attacks. Some extensive studies indeed suggest that calcium supplements modestly increase the risk of heart attack, while other studies haven't found this same connection. The evidence is complex and still evolving, and for individuals with a confirmed diagnosis of osteoporosis, the potential bone health benefits might in fact outweigh the cardiovascular risks. But the overarching lesson here is unequivocally clear. More is not automatically better. The safest and most advisable strategy is to consistently obtain your calcium through a balanced diet. If your doctor ultimately believes you genuinely require a supplement, never, ever begin taking it on your own without their direct guidance. It is a profound medical decision that necessitates carefully weighing your bone health needs against, and very importantly, your unique cardiovascular risk profile. Today, we have courageously pulled back the curtain on the often hidden downsides of 5 very common categories of medications: anti-inflammatories, gastric protectors, decongestants, certain older antidepressants, and calcium supplements. My paramount message to you is not one of panic, nor is it a directive to abruptly stop taking any of your prescribed medications. Doing that on your own without professional guidance would be exceedingly dangerous and could lead to far worse outcomes. Instead, my message is one of powerful empowerment. You now possess invaluable information that the majority of people simply overlook. You understand that the pill you take for arthritis pain could be dangerously overloading your heart. You're now aware that your seemingly benign stomach protector might be silently affecting your heart's critical rhythm. You know that a simple over-the-counter cold remedy could unexpectedly pose a serious cardiac risk. Use this newly acquired knowledge to transform yourself into an active, engaged, and knowledgeable partner in your own health journey. The very next time you visit your doctor, go in prepared. Take with you a complete and accurate list of everything you are taking, including all prescription medications, over-the-counter remedies, herbal supplements, and vitamins. Then ask clear, pointed questions. For instance, "Doctor, I've been researching and I've learned that this particular medication might carry risks for my heart. Is it still truly the very best option for me at my age and with my current health status? Are there perhaps safer, equally effective alternatives we could consider? And should we be actively monitoring anything specific like my blood pressure or running certain tests to ensure my heart's well-being?" Every single medical treatment represents a delicate balance between its potential benefits and its inherent risks. And that critical balance irrevocably shifts and changes as we gracefully age. Your heart has diligently worked hard for you for many decades. It unequivocally deserves the most exquisite and thoughtful care you can provide. Protecting it is, without a doubt, the single most valuable investment you can make in your own future health and longevity. Never take any medication for granted, no matter how commonplace or harmless it may appear. And now I'm asking one last thing from you. Please share your own experiences and thoughts in the comments section below. Did something I shared today truly surprise you? Your personal stories and insights can illuminate paths for countless others. And remember, always, always initiate that vital conversation with your doctor. That conversation, more than any other single step, is the most profoundly important action you can take today to safeguard your heart for a healthier, more vibrant tomorrow. Take exceptional care of yourselves.